Not miss the red flags. I'm saying again here, do not miss the red flags. And then comes to past medical history, family history, and medications and allergy. And then here comes only relevant social history. And always signpost before switching to the social history. Like, I'm going to ask few questions about your personal life and habits. Then ask about alcohol, smoking, drugs, driving, diet, exercise, and sexual history if relevant. And after signposting again, like I'm going to ask few personal questions. Make sure that you finish all the data gathering up to the 6 minutes. If you delayed it to up to 7 or 8 minutes, then it will affect your management, which carries the more marks. Now we are going to switch towards management by using the phrase, thank you for sharing all the information with me. In the start of management, always quote ICE again. For example, if the patient comes to you with tremors and worried about Parkinson's disease, but you are suspecting benign essential tremors, then you can say to the patient, I understand you are worried about the Parkinson's disease, but the information you have given to me, it doesn't look like to the Parkinson's disease. Like you don't have any stiffness of body, any slowness of movement, and there is no change in the gait. So after explaining about the concerns, then explain the diagnosis. Always give the information in the chunks and check the patient understanding more frequently here. And then you can say from the symptoms, it looks like to be a condition called benign essential tremor because it settled down by taking the alcohol. And this is a harmless condition. And you can say, does that make sense? So this sentence will check the patient understanding and will involve the patient. And always do not speak more than 30 seconds in one go. If there are any causes or triggers about the diagnosis, then mention it here. For example, AKI patient on CKD taking NSAIDs, we have to explain the triggers which are positive in the patients, like your kidney functions are dropping due to the medication you are taking. After explaining the triggers or the causes of the diagnosis, you can say the patient, are you with me? Or you can say, does that make sense? Or do you understand? Now comes to the treatment. For example, patient with a high cholesterol, we have the few options to deal with this condition. Briefly explain these options and leave it to the patient to choose, like about lifestyle modifications, including diet and exercise, and a second is medication. We should ask the patient which one you would like to choose first. So you can say which one you would like to talk about first. But in some condition, it's important to give the medication, like stage 2 hypertension, where medication is necessary. Then you can say that at this blood pressure, usually medication is recommended. If it's not controlled well, it may cause heart attack or stroke. And then involve the patient again by saying that, what do you think about that? If patient agrees, then start the medication after explaining the side effect and allergy. But if patient still does not agree despite explaining the risks, then explore the patient. Is there any particular reason that you don't want to take the medication? And try to sort out the concern if possible. If still patient do not want to take the medication, do not force the patient. Encourage the lifestyle modifications and call the patient early follow-up. Do not say the word, I'm going to start that treatment, but always say this is the options and leave it to the patient, what patient chooses. And that's the patient-centered consultation. Always give chunk and then ask the patient. Always give chunk and then ask the patient. And then comes to the safety netting and follow-up where appropriate. Health promotion is also an important point, especially the patient with a chronic disease like asthma, COPD and diabetes, to check whether they are up to date with the vaccination or not. In the end, you can say that I have given you a lot of information and do you have any questions about that? And also you can say that I will send you some leaflet as well.